And is there a such thing as an infant that is too big in comparison? Does that impact their health in any way as far as their size when they are born?
Yes. So we call infants that are born a lot bigger than normal large for gestational age. So the size of a newborn is determined by how long they stay in the mom's womb. So if you take a baby out at 23 weeks versus 40 weeks, you're obviously going to get a larger baby. But even if you take a baby out at 40 weeks and they're 11 pounds, that is way beyond what we'd expect a newborn to be. So that's large for gestational age. As far as uh, oh, back to the question you asked. What was the question you asked?
Impact on health.
Impact on health. So for the child's health, it depends on why they're large for gestational age, right? The most common reason we have children that are large for gestational age is moms that have diabetes. And so there are lots of reasons why moms have diabetes. It could be that she has an insulin issue and it's genetic and it's not related to her eating patterns. Or it could be that the mom has eating patterns that are causing her to have obesity. And as a result, when that baby comes out, they tend to have sugar problems. They're jittery. We have to monitor their levels. And so that alone impacts the child's behavior and growth when they first come out if they can't control their sugar or they have bad sugar levels.
And on the topic of eating patterns and feeding choices, like you mentioned earlier, how do cultural traditions and parental beliefs shape feeding choices in infancy?
Yeah, that is a really good question. So, if you look at the American Academy of Pediatrics and they talk about how to introduce solids in feeding, the recommendation is to continue formula or breast milk for at least the first year of life, at least. The end date is up to you, especially when it's breastfeeding, but usually formula until 1 year of life. Now, when you start to introduce solid foods, there isn't a hard, steadfast rule that the American Academy of Pediatrics adheres to. It is absolutely based on your cultural practices. So in some cultures, they give their babies mangoes, pureed mangoes as the first food. In some cultures, like here in the US, we'll usually do like a rice cereal or a wheat cereal as one of the first foods because it's iron fortified. That really plays a big factor in how you introduce those solid foods as the baby's aging.
Now, have recent trends like baby led weaning or responsive feeding shown impact on mitigating or exacerbating disparities in obesity?
I don't know if I would say that baby let weaning or other, I guess, methods of feeding mitigate disparities, but it may show disparities that exist or that already exist. I do find that parents that have a little bit more education, resources, are able to kind of adhere to different patterns in feeding their child, and that alone tends to give them a better outcome because if you're closely monitoring what your child is eating, you're most likely trying to give them fruits or vegetables or stage one foods and then move to stage two and stage three. And so that alone just kind of makes them have a better outcome. The other thing is, parents that don't tend to know about those patterns tend to be a little more lax in how they introduce foods. And so those may be the parents that introduce the oatmeal at birth, right? Or they're giving them the really salty, buttery mashed potatoes as their first food.